Hi, everyone. I just wanted to hop on and give an update of what we've been learning this last week in school. So, our studies are continuing to focus on the cardiovascular system as it pertains to coronary artery disease. So, that's where there's plaque in the hearts. As it pertains to dysrhythmias, so such as ventricular tachycardia, atrial fibrillation, PVCs, just those like feelings of palpitations, heart failure. So that's where the pumping function of the heart is weak and not pumping effectively, and then stroke. Biggest takeaway from this week, which I knew, but it's just really important, I think, for me to share with people pursuing integrative approaches when it pertains to cardiovascular disease. Integrative approaches, in my opinion, the best time to start it and implement it is before we have disease that is present, and doing it in a preventative way. Now, I'll say we get to a point in our life where we have cardiovascular disease and we're managing it. Integrative medicine is a very useful tool to help minimize progression, to help support current lifestyle and care, but it does not replace those therapies, such as those medications and antiplatelet things and recommendations from cardiology as it pertains to that. So once the disease is present, integrative medicine is more so a complementary tool, and we have tools to help prevent the progression of this disease as well as to support you while you're on those medications of potential side effects you might have, but it's not meant to replace it. A really huge thing in regards to preventing cardiovascular disease and improving results once you have cardiovascular disease is exercise, is physical activity. Ideally, 30 minutes of moderate intensity physical activity, 4 to 5 times a week. It does not have to be all at once. So if that happens in like 10-minute segments, that's perfect. But just moving the body, getting the heart rate up. One of the biggest ways that it works is it works on nitric oxide. So when we're being physically active, it's increasing the nitric oxide levels in the body. And so that helps to improve the dilation, which means allows the blood vessels to get larger, as well as creating this state of balance, so where there's less inflammation in those blood vessels. When I used to work men's health, a lot of patients would share with me like that they're taking these nitric oxide supplements, when the best way to increase nitric oxide production in the body is just moving and getting the heart rate up. Also, some foods that can be beneficial in patients with heart disease are ones that are rich in flavonoids. So some examples, especially as it pertains to heart disease, would be like beets and arugula. Both of those are working also on increasing nitric oxide levels in the body, and they can help to improve blood pressure control. If there is, and then in regards to the supplements that I mentioned earlier, like some people would say, well, is that beneficial? Like if I don't feel like working out, what about taking this nitric oxide supplement? But current research really doesn't show that those supplements have aren't helping to improve the risk as it pertains to cardiovascular disease, whereas evidence shows that physical activity and exercise does. So do I think it'll hurt anything? Probably not. Do I think it's benefiting you? Probably not. And so in my opinion, probably not spending your money on something and just moving your body, and consuming foods that help to increase nitric oxide levels would be beneficial. Um, One thing I learned, so in my brain, I had always thought that caffeine had some role in hypertension, but actually, there has been quite a few studies saying that caffeine does not directly increase blood pressure, but where caffeine can play a role in heart disease is in those dysrhythmias. So, in patients that are having either atrial dysrhythmias or ventricular dysrhythmias, especially as the heart rate is getting faster. Caffeine is a stimulant, and so that can increase the heart rate, or tachycardia is the medical term we'll use. And so it can contribute to heart disease in regards to that, but less so in the blood pressure portion. Lifestyle modifications play a tremendous role in prevention and management of cardiovascular disease. So, increasing physical activity, ensuring good nutrition, and then smoking is a huge risk too. So, quitting smoking. Even if you're smoking 1 cigarette a week, it is causing inflammation in the body. It is increasing cancer risk. It is increasing risk of heart disease. So, getting rid of that at all costs will benefit you in the long run. Yes, so hopefully you learned something. Biggest thing with this segment was just really the importance of movement. Other strategies they had mentioned were yoga for overall health and to help with relaxation, because like I mentioned previously, there's a huge mind heart connection. So if we're experiencing anxiety, if we're having sleep disruption, all of that can increase inflammation in the heart. And then also we talked a bit about the effects of sleep apnea. So if you're snoring at night, if your partner in your room says you have periods of where like you're not breathing, getting a sleep study can be really beneficial. Because if you have sleep apnea, the oxygen levels are dropping in the body. That's increasing stress on the system of the body, so inflammation in the blood vessels of the heart and the brain. It does potentially increase the risk of having a stroke in the future, of having atrial fibrillation. It affects that deep quality sleep, that deep REM cycle. So then you're not getting the restorative sleep that you need. So sleep apnea is definitely something that you have concerns of. Getting it treated will greatly have an effect on your overall health and well-being. So I hope you learned something. If you did, share it down below. Thanks for following along, and I'll see you all later. Bye.